every day we've seen patients that have lost a significant amount of weight with these GLP-1 medications. That does result in lax skin, which is what brings them to the plastic surgeon. And you find in those patients, they don't need a lot of liposuction because they've lost all the weight. So it's mostly a skin excision operation, but those patients have lost elasticity. You have to know the anatomy, you have to know what's normal, and you have to listen to the patient.
Sounds like there's an answer nowadays for every major problem that we have that we're not happy with. And don't go through life hating a part of your body or thinking there's no answer. It sounds to me like you don't have to do a severe surgery. There's so many steps between something that's as minimally invasive as Botox, but as complex as a facelift, and you can do it in stages and make small changes along the way. Welcome to the ManLab, where we combine science and health in the pursuit of making men great again.
This is how legends are born. This is how legends are born.
Hey guys, welcome to the ManLab. As you can see, today we're going to be doing things a little bit differently. This is the first time that we're actually hosting this show without our Aussie friend Blake. So today we are honored to have Dr. Ralph Garramone as our guest and visitor. We're actually in his office today due to his very busy surgical practice. Dr. Garramone's a very well-established plastic surgeon here in Fort Myers, Florida. We work with his office a little bit to help out his clients with some of the healing properties and also referring some of our clients who have potentially lost a lot of weight and needing a little bit of a tuck. And also they send us some clients who are looking for our service to help them continue on with the end result of their surgeries and stuff. So Dr. Garramone, welcome.
Thank you. Thank you for having me. Thanks for coming over and making this possible.
Yeah, of course. So let's just get it started. Give us a little bit of a background. Tell us about yourself, your practice, what you guys specialize here.
So I've been in practice since 2000, so this is our 25th year. I'm a board-certified plastic surgeon, and our practice has evolved over the years. In 2000, the only injectable was Botox, just to put things in perspective. 2000 doesn't seem that long ago. There were essentially no machines. There was no skin tightening. There was no fat losing machines like that. There was only microdermabrasion, which was a rudimentary procedure if you think of what we have today. So over the years, more injectables have become available and refinements in surgery. I would tell you that over the past 25 years, one of the procedures that has undergone the most refinement is liposuction. The instruments have changed. The type of cannulas that we use has changed, and we now incorporate skin tightening with liposuction. But the technique has changed to get an improvement in contour. Contour is really the key to liposuction, not just removing the fat. 25 years ago, we just wanted to remove the fat and make people smaller. Now we want to create curves and highlights.
Or replace it into different areas of the body.
Or place it into different areas of the body, which certainly, absolutely correct, did not exist.
BBLs.
2020.
So are you talking more like athletic lipo or more contour and lipo?
Right. Now, that's not for everybody, but, there's an extreme where you can try to get muscle etching, which, doesn't always look right. Well, that doesn't always look
sometimes
normal,
it looks
and it takes a lot of care afterwards.
Yeah.
But there's a sort of soft etching or, highlights, which works best. All these procedures work best in the patient who exercises already and has some definition, and you sort of just bring the definition
enhance
out
it
by enhancing it with selective removal of fat. So that's a big difference. And there have been refinements, of course, in facial cosmetic surgery and in implant surgery for women. And so things have dramatically changed, really, over the last 25 years.
I think Alex needs calf implants.
Hey, I've considered it. All right, listen, they're stubborn. I try. Do you guys do? Stupid question, but do you do calf?
There
implants?
are calf implants. I have not done that operation.
See, there's hope.
There's hope. Listen,
right.
One thing is funny because our business is based on working from the inside out, right? So we promote the use of peptides and hormones, and the philosophy, of course, is you take these products and it can obviously make your skin better or make your hair grow better and can make your muscles bigger and to a point, or even make your fat kind of deplete. Mm-hmm. But it can only go so far, right? And so the marriage between businesses like ours seems really appropriate in the end result of making someone like look their absolute best. Because if you lose a lot of weight, one of the biggest things that, fortunately myself, I've never had to encounter this, but I've seen this in patients, they lose a lot of weight and all of a sudden they have this like unattractive physique of this like excessive amount of skin. And almost to a point they feel like, well, now that I lost this weight, I look worse. So we're really seeing a revolution in weight loss, right? Like that's a huge thing that we're starting to encounter as a business, that these GLP-1 medications, semaglutide, tirzepatide, people are losing weight that they've never thought they could lose. How have you seen, this really changing what people are coming in for, and to what degree is it a positive, and are you seeing any negatives from that kind of pronounced fast weight loss that people are experiencing?
Well, it's certainly a positive for patients because it makes patients able to lose weight that they couldn't. That's another thing that didn't exist, in 2000. I mean, gastric bypass procedures were here and there, but they were big operations, and that's been refined to be laparoscopic, and then that started the significant weight loss situation, and now you see it also with these GLP-1 medications. So every day where we see patients, we've seen patients that have lost a significant amount of weight, which I would say significant begins around 30 to 50 pounds. That's a lot of weight to lose. And up from there to 100 pounds or over 100 pounds. And like you said, that does result in lax skin, and patients then want to get rid of the lax skin because they look okay in clothing and they look smaller and they're probably healthier, and some of them who might have been a diabetic, don't have to take insulin, or they get off their hypertension medications, but certainly they don't look good with all that lax skin, which is what brings them to the plastic surgeon. And that can affect every part of the body: the face, the neck, arms, abdomen, thighs. And so in most cases in that situation, we need to do a modified operation that we would do in the non-weight loss patient. It involves the excision of more skin and maybe some creative ways to take out that extra skin. And and you find in those patients, they don't need a lot of liposuction because they've lost all the weight. So it's mostly a skin excision operation, but those patients have lost elasticity through the weight gain, weight loss situation. And so sometimes those patients may need a secondary procedure because their skin relaxes.
Right.
And in women, it also affects their breasts. We do augmentations and lifts, and again, those patients may need a secondary procedure to retighten the skin because you can't over-tighten the skin. And in some cases, we combine that with a procedure like Renuvion, which is a tissue tightening procedure that uses heat. And so
is that like a device name, Renuvion?
Renuvion.
Okay.
Renuvion is the device. And there's others like it, but that I would say today is the most prevalent one.
What is the most amount of weight that you've like cut off a person? I'm just curious, like the weight of skin. Like, have you guys ever?
Everyone wants to know that skin doesn't weigh that much. It sounds like we might remove a lot, but I mean, if we remove 10 or 15 pounds,
that's a lot
of skin and fat. That's a lot. Skin by itself, you could remove a lot of skin, and
so
it doesn't end up weighing
big slab of blubber that
right,
you think.
right.
You never could touch with raw skin.
Yeah, I know, but sometimes the skin, which is relatively thin and doesn't weigh much, will have sometimes about 2 inches of fat.
Yeah.
And how often are you
attached
guys
to it, which can be very dense and weigh a lot?
Because it's the adipose tissue.
That's when you're
and the volume
That's
of
when you
it.
get up.
Find out if you may have low testosterone for free with the Atom test. Now, sometimes it's a little bit nerve-wracking to go into a clinic to get a full blood panel to find out your hormone levels. And sometimes you might just want to sort of kick the tires just a little bit. If you are that person, the Atom test is for you. All it is a couple of questions that are completely non-intrusive, non-invasive, that will help give an indication to you whether you may or may not have low testosterone. And the best part is the Atom test is accurate up to 88% of the time. So for something as simple as a questionnaire, that is a very high number. number. Now, if you want to make use of that, you can do it online right now. It takes less than 30 seconds to fill out, and it is at bit.ly/free Adam test. That's free ADAM test. Now, if you don't want to remember that, the link is in the description of wherever you're listening or watching this podcast. And then after you've filled out the questionnaire, you will now have a better idea of whether you may or may not have low testosterone and if you need to take the next step, which is a detailed blood panel with a clinic such as T-Clinics USA. So again, to make use of that, go to bit.ly/free Adam test, and let's continue to making men great again. Let's get back to the show.
How often are you kind of seeing the reverse of this? Like, you know, where people come to you saying, I want a procedure, and you recommend, well, first you have to lose weight, right? Because, of course, like we're talking about the counter, which is, I've lost weight, I now want to do a procedure. But how many times do people come to you looking for maybe the easy way out, which is like, I just want liposuction, or I want a facelift, or maybe I want a tummy tuck, or a BBL, or whatever. And your first recommendation to them is, look, you're too obese, or you're too unhealthy. How often does that happen?
With some regularity, I would say. I mean, if you take a week, we might see 1 or 2 patients a week
That are too big or too unhealthy.
BMI, body mass index, over a certain amount where we're restricted in doing their surgery, or they're at a level where their complication rate is going to be high.
Or they might not even notice it per like where they're at that current moment. You could remove some fat. You could remove, and
it's going to make a small
right.
change.
Yeah, it's like
But
a
I think
small
like
dent.
too, like there's
True.
a lot of people who don't want to put in the work, and they think, well, just suck this crap out of me, right?
Right.
Or contour me so it's attractive. I mean,
Right.
there's a culture of people out there that love this huge butt and they want to trim waist.
That's right.
But now maybe these GLP-1 drugs make guys that are in your field not have to so much say, well, sorry, this client is not eligible. It's like, hey, sorry, client, here's an easier option. Go see a clinic like ours,
Right.
for example.
Right.
And then come back to me in a few weeks, and it's not going to be as dire of a challenge to lose weight. And
Right, and that's, taking care of the whole patient. So, the patient comes in, they're overweight, they want the surgery. They're otherwise a good candidate for the surgery, except for the weight. Now, before these medications, they would start, if they try to diet and exercise on their own,
We're
the
gonna fail at
problem
it.
with that is they'll lose maybe a small amount of weight at a time, and they get discouraged.
Or comfortable.
And they,
or comfortable.
Or comfortable.
Yeah, and then you're like, come on,
But if
like
they
we
do it
gotta
so
go.
slowly,
Right.
then
Yeah.
they're going to kind of lose
lose-
kind of
right.
the momentum.
and
to do
they
this.
lose the momentum, or they never gain the momentum of losing the weight. But once you lose some weight,
Yeah.
and they see some results, that encourages them to go further. And I think these medications help with that. Prior to that, we used to put patients on phentermine
Yeah.
or phendimetrazine, and they would lose several pounds a week. And they'd
Get them down to
lose
that
weight.
manageable range.
And so today, we would routinely refer those patients to you for these GLP-1 medications. We don't prescribe them. I think you do a better job of that than we do.
Yeah.
And then you get the patient to lose some weight, get their BMI down to a safer level. Even if their BMI is not that high, it might be at a level where their complication rate would be higher. And if you get it down lower, their complication rate will be lower, which is good.
I mean,
either way.
you're working on a sculpture, right? So like you ultimately have to decide what's the best starting point for a person too.
True.
And if maybe the opportunity to get the end result to be as good as they hope it to be, you're like, listen, sir, madam, like you need to lose an additional 20 because where I'm starting from isn't going to give you the end result you're looking
Right.
for. So that hesitation or kind of delaying of their practice or their procedure, I should say, maybe isn't what they want to hear.
Oh, no.
But the end result gives them the
Right. But it's the right way. It's
Yeah.
the right thing to do. And I think if you give the average patient reasonable expectations of results and explain to them that this is our limitation with the way you are now, and we have a solution. We're going to send you around the corner, and we're going to get you set up with some medications which are going to make it easier for you to lose the weight. Then you're going to come back at a different starting point, and then your end point is going to be even better.
The transformation is that much.
So have you
possible.
have
Yeah.
you adjusted your kind of expertise to getting more into this body contouring and skin removals and kind of adjusting to the market now?
Absolutely.
So
sure.
you kind of look at yourself into some degree a specialist with these clients who've experienced major weight loss to really helping remove that weight and
Absolutely.
make that physique look
Both
good.
myself and Dr. Garcia do this type of surgery.
Yeah, because I mean, I know clients are always looking for the answer, right? They want to,
Right.
who's the doctor that's good
Right.
at doing this?
Right.
I mean, I know you're great at facelifts and you love other procedures, but having somebody who's very comfortable with weight loss clientele is something
Right.
that I'm sure people want to know of. So
Right. No, it's actually a big part of our practice, and like I said, we're both doing this, and again, it's there are some surgeons who don't want to do it because some of these operations can be lengthy,
Yep.
and I explain that to the patients that you might need 4 operations.
Yep.
A thigh lift is a big operation in a relatively large area. And, sometimes that's a standalone procedure. The abdomen may be a standalone procedure. The
you don't do it
arms-
all in one shot. You're not cutting
And the
the suit
recovery
off of
time's a
somebody.
little bit
Right.
longer
Right.
from something like
Yeah, I've
that.
seen like
Higher.
people do the underside of their arms. with
Brachioplasty.
women, and
Right.
It looks kind of brutal surgery. I mean, but I guess it's better than having a wing hanging.
it seems that way. But I could show you the scars in the average patient look pretty good.
It's better than
So-
an arm, flap hanging off. You're
Right.
looking like a flying squirrel. So, I
Right,
mean,
right,
at what
right,
point are
right,
you-
right. And
at what point are you-
this, I mean, we can treat the scar
Yeah.
afterwards.
And I mean, listen,
Yeah.
if I was one of these
Lasers, things-
people and now you're hesitant on exercising because you have this thing flapping around or you don't want to go out in public with a short sleeve shirt versus wearing maybe a longer sleeve t-shirt that covers the scars.
Yeah.
I mean, it seems like to me the lesser of two evils.
Yeah.
So,
Yeah.
There's a lot more advancement too, just within like not just your field and how the procedures you do, and then like the utensils you use for that to make the scar super small, but like post surgery, scar revision, some of the
Yeah.
lasers that you guys have that you could thin it down, some of the peptides that
Yeah.
we do could heal it up really, really fast and make it
Yeah.
very.
we'll get into the
Yeah.
healing
Yeah.
stuff. I don't
Yeah,
want to jump.
but
ahead
that
too
is
far.
that is a good point though, because in some cases, if the scar isn't ideal, we may be able to treat it with a laser
Yeah.
or a series of
Smooth it
laser
out.
treatments. In some cases, it's a big operation. We try to make the skin tight. Sometimes when the incision is under some tension, it may widen a little bit, just the
Yep.
nature of the skin. And so you can, in those patients, like if they come back you mentioned the arms, when you do a brachioplasty, say they're going to come back and do their abdomen. Well, they're going to be under anesthesia. You could revise that scar at that time, which means excising or removing the original scar
The
because
thick
it was
scar that
wide,
was binding the
right?
big amount of tissue.
And reclose it so it's not going to be under quite as much tension,
Right.
and it should heal with a
Well, that's
finer
how it
scar.
works.
Yeah.
Okay, I've heard
Yeah.
about people like revising scars, and I guess
Right.
you cut the old scar out because it was a heavier job to bind such
Right.
heavy tissue. But then, when it's smaller amount of tissue, the
Right.
scar can essentially.
Then you're just
makes sense.
excising this much instead of this
Yeah,
much
makes
or
sense.
more. Yeah.
One thing I thought about too is like this deflated physique that people can get from the over dieting of even, listen, under our guidance, we experience it too. Like people don't eat protein, they don't work out, they starve themselves away and they lose a lot of muscle tissue. I'm sure there's a component of now that they've kind of stitched up the body and they're feeling healthier and want to exercise, that muscle kind of filling in the blanks is the way to limit that excess drag, if you will. So I know
Right.
you guys have some devices that can
Right.
help stimulate some muscle growth.
So we have a couple of devices that do that. We have M-Sculpt and Evolve, and these are two machines which are designed to stimulate the muscle using electromagnetic energy, so they cause the muscle to contract.
Yep.
And if you haven't tried these,
Like an electric stem.
you should. Right.
Yep.
But you feel the muscle contract, and you go from 0 to 100, and they have a little heating component also to get the muscle warmed up, but also to help with a little bit of fat contouring. And so these devices can improve muscle hypertrophy. Because they cause a much stronger contraction of the muscle than you can generate on your own, and many more contractions
And with a lot less work.
with a lot less work. Yeah.
What's
right.
the difference between
And
the two machines?
The difference in the two machines is how that energy is delivered to the muscle.
So different applications.
There's some differences with M-Sculpt not being able to be used on the chest, whereas the Evolve can be.
Okay.
But otherwise, they can be used in different
There's
areas.
a lot of girls do the M sculpt on their butts, right?
Absolutely.
Like
Yeah.
You always see the Instagram
Yeah,
video
yeah.
of the girls' butt.
The guys,
right.
the guys, you can do it
That's
on the
right.
pecs and give them like a little
Yeah.
bit more meat,
Yeah,
right?
right,
Yeah.
right.
How often do you have
So-
to do that, like to make an impact
Well,
in your muscle
that's you end up doing about 4 treatments in the first 2 weeks.
So it's like
Two
working
treat-
out.
two
You,
treatments
you
a week.
work out, give it a recovery time.
Right.
Yeah.
And like working out, you have to keep doing it.
Yeah.
So
it's
is that
not
something
like
that like a client subscribes to you guys to get a package and
they
comes?
could.
Okay.
They could do that. They could do it as they go, but we have packages where they would get like a membership.
Come here instead of going to the gym,
So
basically.
come in here instead of going to the gym. It works
Sign
best.
me
If
up.
it works best if they're going to the gym,
Both,
and this
yeah.
is
Yeah.
like a supplement.
Got it.
And so that's the best situation. Now, what's along those lines today? I would say this is I don't want to say it's experimental, but it's definitely early on in fat grafting the muscle in various parts of the body.
What do you mean by
So,
that?
so today, if there are some surgeons, a lot of this cutting edge stuff starts in South America, where there's a lot of plastic surgeons. There's a lot of patients who want plastic surgery, and
I live in Miami, so I see it.
you see
I see the Brazilians and the Colombians. all the-
there's less litigation in
Okay.
South America
Yeah.
also. So a lot of new procedures will develop down there and then come to the United States. But what's happening is that today, you can have this done today. If you have liposuction of your abdomen, you can get some of that fat. We talked about transplanting the fat, and you could inject that fat into the rectus muscle, say.
Yeah.
10
To
or
make the
20
muscle
cc's
bigger?
to
Yeah.
make the muscle bigger. So what
No way.
they're showing is it will.
So it's like synthol
Yeah.
almost, Jeff. huh?
Well, it's kind of in a way you're expanding so you're putting it in between the muscle tissue.
Have you ever heard
so
of
it's-
synthol?
No.
Men inject this like oil
Well, it's an
into
oil
their
that
muscle
doesn't
and expand. You'll see these
dissolve.
guys with these abnormally freakishly big arms
Is
on
that
Instagram.
silicone?
It's very similar,
it's like
but
an oil of
It doesn't
some sort, but-
dissolve, so
It
it stays
doesn't.
over time,
So
and then
then
eventually
essentially you're
the
just-
fascia kind of like grows around it.
Yeah.
so
It
it,
looks
takes
really
space.
terrible,
So
but-
it's
Oh,
so it's
cheating.
kind of like a
Yeah.
liquid implant, if you want to.
Okay.
Yeah.
But so you could take my fat and push essentially from my like fat area and put it into the muscle. The muscle will then look that much.
But you would
bigger
actually
and-
go
well-
underneath the layer, so you could see the muscle on top. Correct? Is that what
So
you're
you
saying?
remove the fat
You're
over the
injecting
muscle,
right,
and
right.
then put it into the muscle.
You'd
make
be
the muscle
taking
bigger.
away the fat, so you've got a thinner cover over the muscle, like having a low body fat,
Yeah.
Right.
a low body fat percentage, and then you inject the fat into the muscle to get more definition. Now, but what happens is that the muscle actually hypertrophies. So they've shown this in
'Cause inflammation.
MRIs. The fat doesn't stay. A small percentage of the fat stays, but the fat causes a little bit of inflammation and irritation of the muscle, and the muscle actually grows
Responds
as
from
a
it.
res-
And it
as
looks
a
natural.
response
It's
to
not
that.
going to look like an implant, like a
Yeah,
foreign.
because fat is soft, and the muscle hypertrophy
Wow.
is like muscle.
You want a guinea
hypertrophy.
pig?
So
Leave it to the South Americans figure this one
yeah,
out,
I know,
huh?
I know. And so, I mean, there are some surgeons there who are injecting the deltoid, the biceps. I mean, they're really transformative surgery.
Wow.
And some of that stuff may not come to the United States, but the surgery that I've seen where they inject the rectus muscle in particular, a little bit of the oblique, that
It always
makes a
looks
big
weird
difference.
though. Like when people do their abs, you have these people that aren't really that lean, and they have like
And then
a
they got the
super
crazy-
popped
Yeah.
eight
So-
pack.
right,
It's like,
right. So-
but you're fat everywhere else, and you have an ape.
Right, right. So, and that's a
Who you
problem
fooling?
because
Yeah.
that doesn't look
Right.
natural.
Yeah, like two
And I
different
think,
people.
If you try to get that look just by carving out the fat and leaving
It just
fat over
looks-
the muscle, that's
nobody's
really,
bodies are like that. Yeah.
that's not a good look. Which is why I said the sort of soft etching where you get some highlights
can-
and some
yeah.
definition. In most cases, that looks better.
Like if you're wearing like a half shirt, you can see where the lines would be, but not the actual,
Right.
definition.
Crop top for you.
Right, when I'm wearing my crop top.
Quickly, before we get back to the episode, please hit that subscribe button if you haven't on whatever channel you're watching or listening to the ManLab. And if you're listening on Spotify, if you could leave a 5-star review on the channel page, that would be greatly appreciated because that will help continue to push it a little bit further for whoever is looking for information to help improve their health. Now, on the topic of information, information, if you are on YouTube, you can leave a comment below on this episode and we will respond to it with as much information as possible, or it might be another episode down the road. The reason this is important is because the more questions you guys ask, the more we know what we need to do to serve you guys better in future episodes. So comment on YouTube, leave a 5-star review, hit subscribe, and let's continue to help making men great again. Let's get back to the show.
All right, so we have a couple things we want to hit on. So a lot of our guys are on testosterone. Testosterone therapy creates an unfortunate side effect, which doesn't naturally happen with our clientele, but men on steroids, gynecomastia.
Yeah.
Gynecomastia is the formation of breast tissue. Usually happens when guys' estrogen levels are too high. It creates knots behind the nipple, formation of
glands,
breast tissue. Jeff, we'll
I
talk
actually
about
had it done. I took steroids in high school and
use,
college. Ended up having to have it done, and a lot of guys face that, especially the ones who've kind of dabbled or abused, or we do get a lot of guys that transfer in from other clinics that maybe they weren't managed right. Estrogen was high, and they're coming through the door with gynecomastia. And I've known we've been sending to you for a while, and all your outcomes are amazing. But I've seen some guys go other places that they either take too much of the glands out, that gets concave at the
nipple, where the nipple crinkles in,
or the incisions around the nipples are not that well. And like mine, you can't even tell I had gynecomastia surgery.
Yeah.
I had somebody really
talk
good.
about your kind of experience with it. What makes the way you do it work better than these butchers
Well,
out there?
that's the situation you find most of the time. Now, in most men, 80%, 90% have that firm tissue behind the nipple.
Really?
And the other 10 or 12% will just have fat. If it's just fat, you can treat that with liposuction and perhaps the Renuvion.
Because then you get the laxity.
Right. So in order to avoid the laxity, we would use Renuvion to help tighten the skin.
Okay.
Now, if they have that firm tissue, we have some liposuction instruments that are designed to remove that. But liposuction in general is good at removing fat. Anything that's a little firmer may not be removed as completely as you would like with liposuction alone.
Right.
Some cases you can get it all out if it's a small amount, and if it's going to vary. In some men it will be firmer, kind of rubbery. In some men it won't be quite that firm, and you can take it out easily with a special liposuction cannula. And so if you do the liposuction portion of the case, if you still feel that tissue, what I do is I make a little half moon sort of incision along the lower border of the areola, and take out that firm tissue directly. The mistake is, the goal of the operation is not to remove all of that, because then you can end up with a concavity there, a depression behind the nipple, which then doesn't look
I've seen
good.
it too many times, not from people.
Sure, you could use some kind of filler to fill it back in or something.
Yeah,
You could put some fat in there, but you'd rather avoid it. Right. You'd rather leave enough tissue on the back side of the nipple so it doesn't collapse in, and then take out the rest. Because what I tell patients is that there's going to be some tissue left there in order to have because what we want is a good contour.
Look natural.
Natural contour. We don't want a depression, and we're not trying to remove it all because that'll leave a depression for sure. And I think, today I try to liposuction, the outside of the chest in order to create a border of the outer border of the pectoralis muscle to sort of define that. Mm-hmm. And then, which is
you're already in there. Might as well shape it up.
Right. And that's a part of the refinements in liposuction. We do that in women's surgery.
Just because I'm familiar so much with the true anatomy, is kind of, I should know this, but I don't know. People talk about removing the gland.
That's what I'm talking about.
So this gland, when it's gone, does that mean that you will never regrow gynecomastia on that part of your chest again? Do all men with gynecomastia have to remove the gland, or can you simply just remove the fat? Because again, a lot of our guys, steroid users, hormone users, if you're susceptible to this and you get it removed, the worry is it going to come back? And so I've heard different people say, well, I have my glands removed, therefore it's permanent. And then I've heard people say, well, I just had the etching or the fat removed. So what is the difference in making that determination on the physician side or surgeon side?
You could remove either way. In order to avoid a contour irregularity, you're going to leave a little bit of that tissue. Yeah. You're going to leave, let's just say 10%, and you're going to take away 90%. I haven't seen that come back because patients usually their hormones are managed better.
Right.
You know, once they come in or they're off the testosterone or, you know,
Well,
whatever.
even then, I think you get it to the point where, if it was hard, it got to the point where it was hard and the gland actually needed to remove. Because actually, there's multiple glands, correct, in the
Right,
chest.
right.
So you're taking the most abundant or most superficial one that's actually kind of showing that bulging or gynecomastia look.
Right.
And then, so, you know, removing just enough to fix that, leave enough room for if there were any changes. And that's what I say, like, every one I've seen you do has been spot on and amazing. But I've seen them, like, they just go in, they get the guy that doesn't really specialize in that. They remove too much tissue, too much glands, and all of a sudden it's concaved.
A lot of guys' physiques are not consistent and steady, right? I mean, we put on
Absolutely.
fat, we lose fat, we get kind of fluffy at one point, we're leaner
Right.
at another, and so maybe there's a very volatility
Yeah.
that
And some patients have more definition of the pectoralis muscle. So,
Yeah.
you know, their results are going to be better. Take the fat away, the muscle shows.
yeah, well, I've
better.
had a shitty chest my whole life, so like I've never had that really defined chest look,
Right.
no matter how much I trained, and like it's always been, no matter at my leanest, I still always carry more fat in my chest.
Yeah.
But
I
I
don't
always
ever have the actual like not lumps, but I've
Yeah.
always carried more fat in my chest.
Well, I was saying, like, plastics, you know, like, I look at you guys as you guys are artists of the human body, and you guys, it just amazes me. Like, even if you watch some of, like, the online shows or Botched or some of those other ones, when those guys, the vision you guys have, the ones that are truly skilled like yourself, to be able to see what we don't see and be able to kind of take it for what it is and shape it into, you know, like, have that vision and know what it's going to look like when it's done is amazing to
well,
me.
you have to think forward. It's
Yeah.
not just like what you're doing at the
that's
therapy.
a huge
it's how it
part. Well, you have
heals.
to know the anatomy. You have to know what's normal. You have to know what's attractive also.
Yeah.
That may not necessarily be what's normal. You know
What I
mean?
want
People
might be different than what you think it should look like. Yeah.
And you have to listen to the patient. Now, that's a little treacherous because if the patient has a unnatural vision of normal and they come to you and want that, you know, that's you got to talk about that and say, and you may have to not operate on that patient if they want
there's
to
an
look
ethical
odd
position.
right?
Well, in a
Where you
day,
put
it's
yourself
your
to not look
track
like somebody
record
looking for
too.
you.
Right,
And like I said,
right.
I see
Somebody walk
some
around.
people
Oh,
that-
Garramone gave me these size triple G.
right.
Like, nah, I'm not doing it. I'm
so,
good.
So, you know, you have to be a little careful with that. And you have to have a discussion with the patient. I mean, you want to please the patient if you can. And, I mean, they may not want to look odd. They may want something that you can't provide. And, you know, you have to tell them.
Unrealistic
you know,
expectations of the outcome.
But for most men, it's a combination. Their underlying anatomy is going to vary. So how much pec development they have is going to vary. The more they have, the more definition you get afterwards. Because once you take away the fat, you're looking, you know, at the muscle, and then that gland tends to make the nipple sort of poke out,
Yep.
which is what most men don't like about it.
Mine look like I'm like cutting, like I could cut glass all day, every day. They're there. I don't mind it, but like it actually looked pretty good.
Is that
so.
since post surgery?
Yeah,
You got
no,
an
they're
insert,
like
a little
they're
model?
like super tight and perky.
You got
They're
an
good.
insert.
I got
On a complete side note, do you know that the girls nowadays have these things that they can put into their shirts specifically so it makes it look like their nipples are sticking all the time?
Yeah.
I mean, I'll tell you what, the world's getting crazy, but like it's these
That's right.
inserts that they put in just to make you stare
That's
at
right.
their tits when they walk.
That's the Kim Kardashian bra. It's got little, you know, little.
Like, what do you think I'm looking at?
Yeah.
The thing you put there for me to stare. Anyway, sorry about Jeff and the nipples. We'll go back to Jeff's nipples.
Yeah, no, we're good.
So yeah, going back to so guys have gynecomastia. That's not the end of the world. The surgery, how big of a deal is it? You know, is it taking?
Well,
the
you know, I
gym?
mean,
Is
it's real surgery. You know, you're going to have anesthesia. You're going to have liposuction. You're going to be a little bit sore afterwards. An important part after any liposuction, man or woman, is we're going to be in compression afterwards.
how long can I go back to the gym for? That's the biggest.
I
part.
usually have patients take it easy for 2 weeks.
Yeah.
For most
that's doable.
surgery, I have you take it easy for 2 weeks so you don't aggravate bleeding and more swelling. And then I usually have you exercise light for a couple of weeks
just to get the lymphatic system
just
moving.
to get things moving.
But don't be doing like heavy chest and all
Right,
that stuff.
right. And
Flies.
the operated on area,
Yep.
you would go back to last. So, you know, if you had gynecomastia surgery, you might be doing legs a little
More.
bit and biceps and triceps, and then the
Gotta do
last
legs
thing would
again.
be.
I will say this though: the
That's what it
guys
is.
that let it get really, really bad, the recovery is a lot harder and a lot longer because of the amount of reconstruction you have to do versus someone who nips it in the bud early or is able to. It's a lot fast. I mean, like I was pretty on top of it, so I felt like my recovery.
Well, there's
was really,
things that
really
people
quick.
do to aggravate, like they smoke marijuana or they drink
Yeah.
heavy alcohol, and it's
Yeah.
consistently like aggravating the gynecomastia that may be pre-existing.
Sure.
Yeah.
You know, we tell people that it's not always hormone induced. It could have been something you were born with.
Sure.
It could be other ancillary drug use, and so
Right.
So, look, I mean, I think if you're walking around, you know, having used steroids or testosterone, you're to some degree wanting to have a nice physique, and there's nothing worse than being proud of what you look like. And going back to the weight loss clients, that you look good in clothes but never want to take your shirt off because you're embarrassed that this
Right.
thing is there. And I'm sure there is also a medical risk in having that breast tissue. Maybe it has a hyperpotency for breast cancer in men.
Sure.
I assume.
Sure.
Yeah,
Right.
so-
and so there's a good reason to remove it. I would tell you that for most men having that surgery, it's a cosmetic appearance, aesthetic reason, and which is okay. I mean, that's what we do, the majority of the time. But you're right. People will spend a lot of time in the gym and to get looking the way they want. And, every fella that comes in with gynecomastia will tell you they don't want to take their shirt off. At the
Yeah,
pool
they're
or
embarrassed in
the
front of
gym.
their girl. They're,
Yeah.
it's got to be a really, it's like having, I remember when I was younger and I first started taking hormones, I got really bad breakouts from it. So you look great,
Yeah.
you take your shirt off and it's like, look at your back, looks terrible, and so
Yeah.
of course I took Accutane when I was
Yeah.
in my early 20s.
that was
And
rough.
I resolved that, but it was a really rough road, but I resolved that problem.
Yeah, yeah.
And, nothing more, what I think would suck even worse is if I had this giant,
You're
obvious
fine, just
breast
wear
that
pasties, you're
everybody
good.
knew I took steroids because of it. You can't even
Yeah.
pretend that's not the case.
Yeah,
So
right.
Yeah.
Right.
what else is kind of the trend with
Trend.
men nowadays? Like what are guys doing more today than we've ever seen before? I know I'm sure Botox and stuff, but what's
Sure. So men today are more likely to come in for liposuction, not just of their chest, or if they come in for their chest and they have this love handle area, that is an area that's very resistant to diet and exercise. And so you'll get fellas who come in, they're otherwise lean, they're otherwise like the way they look, can't get rid of that.
And that
Do
little,
you guys-
little lower belly fat
right,
pooch,
right? Right. Upper abdomen in men, usually that's pretty good. I'll do a little bit of liposuction there but they'll come in mainly for the love handle area and the lower abdomen.
Does that skin tend to tighten up too, or is that going to be a problem?
In most cases, unless you have a significant weight loss patient, in most cases the skin will contract. I think we have technology now that we can apply to the skin in almost everybody.
And peptides, by the way.
To assure, right, to assure that the skin contracts.
So you guys, I know you like everyone knows of the mommy makeover. Do you guys got like a daddy makeover, like a 50-year-old daddy makeover?
Well,
'Cause,
yeah.
like,
I mean,
what does that look like?
I've operated on several men in their 50s, 50 to 60, to take away that
Flank.
that love handle,
Yeah.
flank area, and their lower abdomen. And a couple of those fellas have come back, 6 months later, and they were at a pool party, and they said, they look better than their son.
Yeah.
Because their son had that flank. That really affects
Yeah,
how
I mean,
you look. in-
even at my leanest, like that's always been my spot. Matter of
Yeah.
fact, that's the
You got a
spot I
muffin
take
top?
all my injections. I take all my peptides and stuff because it's the only, I have no fat really on
Yeah.
my front part of my abdomen, never have,
Right.
but I always have a little.
Right. And that is
Somebody checking in here for about 2 weeks.
No,
I told you I'm coming for the 50-year-old
That's right,
daddy
yeah.
makeover.
That is an ideal area for liposuction because you can't.
But my
you
worry
can't treat it
then-
with exercise or diet.
Yeah.
Nuviva Medical Weight Loss has helped over 50,000 men and women in Florida lose over 500,000 pounds in body fat. Now, there are wonder drugs out there like semaglutide and tirzepatide, but it's important that these tools are used properly and safely with the correct guidance, because that guidance is what will help you make sure that you're losing that unwanted body fat while keeping the lean muscle mass. Nuviva Medical Weight Loss has over 10 clinics statewide in Florida with expert coaches who are with you the entire way, helping you with any habit adjustment, large or small. The secret behind Nuviva's continual success with their clients is their in-office expert experience. You will speak directly with a support coach, and if you have any questions, you will get immediate answers. If you are struggling, you will get immediate adjustments or pivots that will keep you on track with your goals. And what's great is you can choose the route of your weight loss goals. So if you just want to take diet adjustments and some supplements, you can do it. However, if you want to go a little bit of a stronger, faster approach and use semaglutide or tirzepatide, the Nuviva expert coaches can also help you along the way with that as well. So if you have a lot of pounds to lose or even just a few pounds and you know that having some support with an expert coach will get you there faster, contact Nuviva at either nuvivaweightloss.com or send them a message on Instagram at Nuviva Weight Loss and mention the ManLab for a little perk. That is Nuviva, Nuviva weightloss.com or at Nuviva Weight Loss on Instagram. So hit up Nuviva, get an expert coach, get that support you want, and let's get you feeling amazing again and lighter again. Let's get back to the show.
All right, so
it's like the
a
last
common
place to go.
misconception maybe. You remove the fat from here, does it go somewhere else?
Yeah,
People
that
always
is-
think you liposuction fat out of the body, then I'm going to start getting fat arms or fat legs because
Right.
of that. Is that
right.
true?
No. So the fat, you have as many fat cells as you have in your body at around the age of puberty, right? And those fat cells, when you gain weight, the fat cells will increase in size or decrease when you lose weight. So the difference with liposuction is you're removing those fat cells permanently, right? They're out of your body.
Okay.
So if you maintain your weight, you know,
Right.
if you're healthy guys who maintain your weight, nothing is going to change. You're just going to have an improvement in the areas.
I already know what he's about to say. If you eat like an
if
asshole,
I overeat calories
Yes.
and I've traditionally put those weight on in my flanks,
Right.
and never had it, for example, in my chest,
Right.
Right.
Am I now going to be in like
The other
what my
cells
body's
are gonna
plan
pick it
B
up.
is going to say? Oh well, those cells aren't there anymore, so now you're going to
Right.
get fat
Yeah.
chest.
You're still going to gain. We don't remove. Remember, we don't remove
All of
all
it.
the fat cells. So you're going to gain some there, and then you're going to gain more in these secondary areas.
Yeah.
But you know, that's only going to happen to the patient who gains
Excessive,
that's a lot
more
of weight.
than
You know,
what
you
they're-
vary
if
your
you're,
weight
going
by
through the
10 or
procedure
20
and spending the
pounds,
money, like keep it going.
So just to, before,
Right.
just because again, from my own personal note, if I was to decide to want to do this, would you recommend a non-obese person to try to come in at what they think is their traditional heavier set physique, so you have more of a way to kind of look at me and say, I know how much to remove without depleting it beyond what when you're at your leaner physique will look like? Or would you rather me come in where
Yeah,
I'm
I-
happy being at? Like, should I kind of chunken up a little bit?
Not
Just to
necessarily.
give you more to work with?
No.
So
no.
that doesn't.
That's no.
So I know with
advantage.
girls with BBLs, you do that. Like
Yeah.
a lean girl, you say,
Well, you
fat.
gotta sometimes
Well,
you gotta have
so I
that,
have more to work with.
that's
hit.
not ideal either, because then if they lose weight after, that fat that was transplanted is going to decrease
loses
in
with it.
size.
Yep.
So that operation has a name, actually, a skinny BBL it's called, for
Yeah.
patients who don't have that much fat. And so what happens is, you know, you have to assess that patient. This is, you know, going to be in women, and you have to assess where you can get fat. You may have to liposuction several areas. You're going to get less fat than in a, you know, patient who weighs more. And then you have to talk to that patient and prioritize where you want that fat to be. What's
Because
your
as they
primary
lose weight,
area and
it's gonna-
secondary area, because you're not going to have that much fat. So you want to treat the areas that are their
Ration
primary
it.
concern.
You're
ration
rationing.
it. Ration the fat.
Where are they
Exactly.
at with like obviously with advancement in
And
science?
but in the same vein there, you can get some hypertrophy of the muscle, you know, using M-Sculpt
Yep.
or Evolve, you know,
to help kind of
to help
further
out.
the growth of that area. That
Exactly.
Yeah.
Exactly.
Well, I was just going to like with advancements with like cellular therapies and stuff like that. Like, what about donor fat? Yeah, like, is that a
Yeah.
thing?
The body would reject it.
No.
I
Yeah,
guess,
you would reject
I mean,
that.
yeah.
Like that.
Or
So
can
how
they start
important-
cloning fat?
One thing I know about
Right.
fat
Not
transfers
yet.
is the blood flow capability, the angiogenesis of that area, right? Like the
Right.
stimulation of blood flow and blood vessels. And thinking this through, there's a peptide that we offer called BPC-157, body protective compound number 157. It's known as a healing peptide, but really one of its primary properties is the stimulation of new blood flow vessels.
Yep.
And to think through this, maybe the introduction of that peptide along with some of these fat transfers would help increase the body's want to grow blood vessels through that fat. I mean, is there any reality to thinking that through? Or
There is
because
some,
without the blood flow, the fat dies, right?
right.
Like that's
there is
essentially
some
how it
reality to that. That, you know, if you're in a situation where you want vascularization of this grafted fat, right? You're taking the fat out of the body. It has no blood supply. You're transplanting it into the body. It has to get its blood supply and nutrients, which it does from being near other healthy fat cells, which is why you can't over fat graft an area, or you'll have these transplanted fat cells next to other transplanted fat cells, neither of which has blood supply, and they can't survive.
Yeah.
Now, and so if you had a method to improve blood vessel
Formulation.
production,
It should work.
that could help.
Yeah, it'd be an interesting story, and I know that's kind of we're going to lead into like the healing, the importance of healing, and how significant that is in the end result. But the importance of maybe integration of some of these healing peptides, and wondering like what would the outcome ultimately be. And I'm sure I'm sure you've had clients who've been on them. I'm sure there's no documented study to report on that, but like again, I know a lot of girls that are, especially going on tirzepatide, semaglutide, their concern is at some point I want to get, liposuction. What else can I do when I do it to kind of go out the back end with the best result? And I always say for number one starters, and just a disclaimer, if you're on GLP-1 drug, you have to tell your surgeon so they can tell you to stop
couple weeks
prior to, because there's complications
absolutely
with using that
Anesthesia
medication, because the slowing down of the digestion of food and the metabolism of the anesthesia can really put you at a lot of risk on that operating table.
Absolutely.
So stop like a minimum 2 weeks ahead of time, right?
At least 2 weeks.
And then of course you don't want to keep taking the stuff after a fat graft, because you got to kind of feed the fat, so you don't want to be starving.
Right.
But maybe the introduction of some of these like healing based peptides would be a really great tool. So we actually kind of created an alliance and a partnership in this concept. Like we said to Dr. Garramone's office, when you have a patient who is about to go through a therapy that potentially is going to require some better quality healing properties, that we could create a protocol. Oral BPC 157 is what we recommend to start with, and then post therapy, maybe some injectable based products that can help really stimulate the body's healing.
Right.
And blood flow is included in that. Aside from the peptide use, post surgery, what are you telling people to do from a diet standpoint, from a lifestyle standpoint, that helps somebody heal better? Like, is drink more water? Is it staying away from particular foods?
Well, certainly
Alcohol?
you want patients to stay hydrated. So drinking a lot of water is important. A lot of patients, your body is healing. Your body's had an injury, essentially, with surgery. And so your body is healing. It can be a significant percentage of your body. And so your body needs calories and protein to heal. It needs nutrients. And a lot of patients after surgery, they've had anesthesia, they're taking some pain medication, they might not have much of an appetite. So it's not uncommon for patients after surgery to just nibble and think they're
And they have constipation
eating
issues
okay.
too, and that's
constipation
always
issue can be an issue with narcotic medications, especially. And so I try to get patients to get protein shakes in the house before surgery, and really recommend 3 of those a day, to supplement their little meals. They may have, a few bites of egg and toast in the morning, and then they get, calories and protein in a relatively small, volume, which they can usually, that's not too much. And so even though they're not eating enough, they're still getting enough calories and protein to nourish their body so they heal. And depending on the operation, vitamin C is important for the production of collagen, which can be helpful. But beyond that, I don't really recommend any additional supplements. I think the peptides are a step up from what patients can do on their own.
Because a younger client is going to heal better than an older client.
Sure.
So biologically,
Right.
we can't change somebody's true number on the calendar, but we can physiologically reduce what their body kind of thinks it is by age, by improving growth hormone presence or increasing NAD levels. I know we're getting close to the end of time here, but Dr. Garramone, like you became a client of ours about a year plus ago.
Right.
Hey guys, so just quickly, we've noticed a lot of you commenting that you're not sure where you can go to get trusted and safe peptides, semaglutide, tirzepatide, testosterone replacement therapy, or testosterone boosting therapy. And we wanted to just make mention that T Clinics USA is one of those places. Now, Alex and Jeff, who you see in this podcast frequently, they're probably in this podcast right now with me. They are from T Clinics USA. And as they've shown in episode after episode, details is what matters. So just because you may want something or think you need something, they are going to make sure that you are getting the thing that is right for the goal that you have. And what's better is they offer a 10% introduction discount to anyone who is listening to the ManLab. So that is you. So if you wanted to make use of that, get peptides or testosterone from a place that you can trust that have your goals in mind and want to show you the right way to get there, go to tclinicsusa.com, mention the ManLab for 10% off your first package, and you can even ask Alex or Jeff directly any questions you may or may not have, which is kind of cool. So just again, tclinicsusa.com. If you don't want to remember that, the link is in the description of wherever you are listening or watching this podcast. Mention the ManLab in the contact form and you will receive 10% off your first package. Now let's get back to the show.
You've started using some hormones yourself personally. Is there anything that you've experienced through the use of your hormone therapy and what we've kind of started you on that definitely you would recommend not only to your future clients, but maybe just anybody trying to encounter this anti-aging thing that we're all trying to fight against?
I think everybody is. I mean, I think there's a number of peptides that can help, your skin look better, your hair look better, you feel better. And I think those are good, not just around the time you have surgery, but for people to look and feel better. And I think, and we've talked about this also, some very small dose GLP-1 medication for someone that doesn't really, doesn't need to lose 50 pounds, just wants to, lose a little bit
range
in order to,
maintain. And honestly, longevity, keeping circulating sugar down, inflammation down.
Right.
That's the game.
Right.
Cool. Was there anything else you want to bring up? Anything else that you guys are working on that you'd like to talk to our clients that we should consider, telling people to?
Well, the other thing, we touched on this a little bit. I mean, it's not all about liposuction for men. There are men who come in, whether it's from weight loss or age, the neck doesn't age as well as the face in men. They'll get that turkey neck, and they'll complain about that. And there's a couple of ways to treat that.
You mean the under neck fat deposit? I actually had mine liposuctioned out.
Right. It might be fat.
And a little bit of a laser stimulation.
Right,
I always had that. My mom gave me that fat neck.
That's right.
Gobble when I was
That's
younger.
right. So that's a combination of things. It might be loose skin. There might be some fat there. There might be some laxity of the muscle underneath as well. And so depending on the issue and depending on the age of the patient, sometimes you can get away with just liposuction or maybe one of the skin tightening procedures like Renuvion or Face Tight. In some cases, if there's some early muscle laxity, we might do that. Liposuction and Renuvion, we might make an incision here and tighten that muscle in order to get a better angle here. And if there's more skin, then they need more of an operation with an incision behind the ear to help tighten the skin. And depending on your hair, you might not want that scar behind your ear, or you may want a limited incision behind the ear and more of an energy-based device to get skin tightening. But certainly neck surgery, eyelid surgery in men. Some men will come in for their upper eyelids. Most men who have sort of a full upper eyelid will look okay. If you look, there's a lot of celebrities that have a full upper eyelid or even a low eyebrow position, and that's okay in men, not so much in women. Lower eyelid surgery, puffiness of your lower eyelids can make you look old. It can make you look heavy, tired. That's a relatively straightforward operation.
Lower
blepharoplasty.
Eyes tell the story, right?
Makes a huge difference in how someone looks and how they are perceived by others.
Yeah, guys. Look, don't neglect your faces. We all hit the gym, we train. So many guys are embarrassed. They think I'm not going to do surgery. I'm not going to do Botox. If your face looks like shit,
someone yelled at me today because he was like, "You get Botox?" I'm like, "Yeah, I get Botox."
I've been doing Botox since I was in my 20s. I actually kind of stopped doing it so much because I feel like NAD+, the amount of NAD+ I use metabolizes so fast to a point where I was doing it almost like once every month and a half, and it was still not taking.
Yeah.
And I don't know if that's just me and
just
the product has
metabolically.
changed over the years, or if you're encountering that more with
I do think
the amount of stuff I take, I don't know.
that men and women who are more fit and who exercise more tend to metabolize those products a little bit more
Gets expensive.
quickly. It gets expensive. Yeah.
Yeah, listen, guys. For the men out there, you know, it sounds like there's an answer nowadays for every major problem that we have that we're not happy
Yeah.
with. And don't go through life like hating a part of your body or thinking there's no answer. It sounds to me like you don't have to do a severe surgery. That there's so many steps between kind of something that's as minimally invasive as Botox, but as complex as a facelift.
Sure.
And you can do it in stages and kind of make small changes along the way. We'll play a role on helping the interior side kind of heal up faster or maybe look a little prettier just naturally. But I think there's a combination of both that's required to
if
look
you're
our best.
ugly, we can't help.
Well, yeah, if anybody wants to get in touch with Dr. Garramone, we're going to have his contact in our bio, and it sounds to me like he works really, really well with all men.
Oh, yeah.
Big or small, fat or skinny. So
That's right.
Check him out if you want to
That's
build
right.
muscle, you want to lose fat, you want to cut off skin. Like they got an answer everything here.
Yeah.
So
Yeah, between the two of us, I think we have an answer for
yeah,
most
man.
issues.
We're making
for
men great again. aren't
When
we?
can I get
right.
when can I get a daddy makeover?
Yeah.
Yeah, right.
I
right.
actually, I'll probably do it at some point.
We'll book it up. Well, thanks a lot, man. I appreciate your time today.
Thank
I know
you.
you got to do surgery this afternoon.
Thank
so
you
we
both.
appreciate you coming.
Yeah, appreciate
Appreciate it.
it. Appreciate it.
Thank
Yeah.
you.
Thanks, bud.
Thank you.
Thanks, Scott. Everybody for tuning in today, and we'll see you on the next episode. Peace.